Good evening, everyone, and welcome to BioVanguard Talk presentation. For today's presentation, Ananya Khan is our presenter, and she will be discussing on the topic hearing loss among teachers, a major public health challenge. Before we dive into the presentation, let me introduce Ananya. Ananya Khan specializes in population research, focusing on aging, the socioeconomic challenges of marginalized communities, and gender dynamics. She holds a master's in population studies from the International Institute for Population Sciences, Mumbai, and a master's in geography from Vishwabharati University, Santiniketan. Her academic background has equipped her with expertise in demography, statistical analysis, GIS, and research methodology, making her a valuable contributor to interdisciplinary research initiatives. Ananya is also actively involved in projects addressing socioeconomic disparities and health challenges, particularly among the aging population. Now, I warmly welcome Ananya to give her presentation.
Thank you for the introduction, Uma. Good evening, everyone. And today I'll be presenting on the research work titled Hearing Loss Among Teachers, a Major Public Health Challenge. So, hearing is a key component of human intrinsic capacity. It is the sensory organ that is most relied upon to communicate and engage with others. And any decline in it at any point during the life course, if not addressed in a timely manner, can have adverse effect on day-to-day functioning. And the present scenario is quite serious. According to the World Health Organization report on hearing, 1.57 billion people around the world have had hearing loss in 2019, which is the 20.3% of the total world population. And it is projected that by 2050, this number will rise up to 2.45 billion. One of the major causes of hearing loss is older age. Over 58% of moderate or higher grade hearing loss is experienced by adults over the age of 60 years. And as shown in this bar graph, it is rising from 12.7% at 60 years and at 60 years and to 58% at 90 years. And with increasing retirement age in many countries, hearing loss can be a barrier against productivity. Unaddressed hearing loss can be a negative impact on various aspects of life like communication, mental health, cognition, and interpersonal relationships and employment as well. Moreover, it also has negative impacts on economic costs. The global economic costs on hearing loss in 2019 was estimated over $981 billion, which included costs related to healthcare, education, productivity losses, and societal costs. Despite the increasing problem of hearing loss in aging working population, few studies have addressed this issue and its consequences for work. It is an important research arena because it is a major barrier in communication. As workers with hearing loss, communicating with others can be very challenging and it can be a strenuous activity. So far, only one study has been found to examine workability among workers with hearing loss, which reported that higher degree of hearing loss was associated with poor workability, but it didn't investigate and compared the workability of normal hearing workers. Some other related studies also have inconclusive findings, which is majorly because they undertook heterogeneous groups of workers in their study. So, based on the research findings and gaps in previous studies, the authors developed the hypothesis that hearing loss impacts the work outcomes of people in communicative jobs, for example, teachers. And the authors chose teachers because the primary element of teaching is effective communication, and it can be highly demanding profession for people with hearing loss. Particularly, it can be a risk factor of poor workability, more sick leaves, and ultimately premature work exit. Therefore, the aim of the study was to investigate the association of hearing loss with workability and sick leaves among teachers. Prior to this, the authors of this study had conducted a similar study titled Hearing Loss and Sustainable Employability Study, where they found that hearing loss was associated with poorer work capability, which is a barrier for sustained employability. The data used here was collected around April 2014 to June 2015, and this data has been employed in the current study as well. It is a convenient sample which was based on an online survey where teachers were recruited via schools, educational sector organizations, and trade unions. The online survey included the Dutch National Hearing Test, which is an online speech in noise screening test for hearing loss, and the test calculates the lowest volume at which a person can correctly repeat 50% of spoken words, and it is called speech reception threshold. And a higher SRT score indicates a higher degree of hearing loss, and the outcome variable, that is workability, is compared was compared with current workability with lifetime best on a range of 0 to 10. The statistical analysis was conducted in IBM SPSS to show the baseline characteristic of teachers. Kruskal-Wallis and chi-square test was employed, and to examine the associations of hearing loss and workability, Poisson regression analysis was employed, adjusting for the covariates. The results of the study reveals that among 737 teachers, 69% of them had good hearing ability, 20% of them had insufficient hearing, and 12% of them had poor hearing ability. And compared to teachers with insufficient and good hearing, teachers with poor hearing were at a higher risk, where 66% of them were older people, and for over 56%, 66% of them were older people over 56 years of age, and 73% of them had poor to moderate work ability, and 47% of them had been on sick leave days, and they reported on average 5.6 sick leave days. So, according to the authors of this study, this is the first study that investigated association between hearing loss with workability and sick leave among teachers, which is a profession with high auditory demands. As per the results, teachers with insufficient hearing experience poorer workability than good hearing teachers. Poor workability is a potential predictor of future work participation problems such as sick leave days and early work exit into disability pension. Similar to the previous study findings from this author, the current study also reveals that hearing loss poses a threat to the workers in communicative jobs, and therefore it demands more attention from the occupational health professionals. The study also found that teachers with poor hearing had higher prevalence of sick leave than good hearing teachers. And the results are in contrast with other study findings, because this study included the sick leave of normal hearing workers in the analysis, unlike the other studies. Therefore, it is quite conceivable that the workers in communicative jobs are hindered more by hearing loss. And one of the major strengths of this study is its focus on hearing loss, specifically among teachers. Another strength is the use of Dutch National Hearing Test to determine the hearing status rather than getting it manually from the workers. It enabled to classify that teachers it enabled to classify the teachers in good, insufficient, and poor hearing category. The cross-sectional design of the study is a limitation, and as it restricts the analysis of future prospects and trends. Another limitation is the use of a convenient sample, because the sample lacks the information of non-participant teachers and its characteristics, so it leaves no way to determine if the population was representative. And the third limitation is the use of self-reported data, because such kind of data might have recall and information bias. That is, they could misremember or underreport certain aspects of the tests. The World Health Organization has proposed key public interventions for ear and hearing care provision across the life course and summarized it in this acronym. So here the first letter H indicates hearing screening and intervention. ear disease prevention and management, access to technologies, rehabilitation services, improved communication, noise reduction, and greater community management. And this report emphasizes that implementing these public health interventions will significantly improve the lives of individuals and their families. As part of these interventions, the World Health Organization also recommends hearing screening for all adults from the age of 60 years and onwards. Uh, and for that, they have also developed an application called Hear Who app in the motive to increase awareness among people. The World Health Organization also suggests earlier detection and intervention in hearing loss. Earlier identification of hearing loss could forestall negative impacts of unrecognized hearing loss, and it would facilitate timely prevention and intervention and rehabilitation. Early occupational rehabilitation intervention can be very effective because according to a study done by Kramer, shows that hearing impaired workers presented with stress related complaints such as fatigue, strain, and burnout. The Dutch occupational health guideline for hearing impairment and tinnitus recommends to refer workers with hearing disability to an audiologist if work performance and communication are negatively affected, or if the working conditions have to be accommodated. Hearing loss, in conclusion, hearing loss might be a risk factor for work participation, particularly among older workers in communicative jobs. Public health professionals should take these findings into account in their efforts to maintain a healthy workforce. Periodic hearing screening of teachers could identify hearing loss and enable timely work accommodations and audiological rehabilitation to maintain work participation and prevent premature work exit in disability pension. Thank you so much.
Thank you, Ananya. Thank you for the presentation. We already have a question from Numair. What are the factors which put teachers at a risk of hearing loss?
Uh, so, um, mm, so basically, teachers need to communicate on a daily basis, and it requires I think more like if they have a standard or perfect hearing ability, it will be the setting in like in a classroom setting. It will be helpful for both the teachers and students to have an effective communication.
Okay.
Hearing loss might be a hindrance in that process.
Okay. So, in others, if you have any questions, you can also type in the chat box. Yeah, I think there are no any other questions. So, with this, I think we can conclude. Thank you, Ananya. Thank you for your nice presentation, and I thank everyone for attending the session.
Thank you so much.
Thank you.